Presentation 2. Remember, this program is based on the Registered Behavior Technician task list and it is designed to meet the 40-hour training requirement for the RBT credential. This program is offered independent of the BACB. Let's talk about the ABCs. Start to think of all behavior in terms of the ABCs. All willful behavior happens in this fashion. Consequences do have a stronger hold on behavior. Antecedents may signal that a specific reinforcement is imminent, but it is the history of consequence that affects our behavior the most. Again, antecedents are what occurs right before the behavior, and consequences are what occurs right after the behavior. ABCs of behavior and data. As a registered behavior technician, you are expected to pay attention to the ABCs of a patient's behavior. Another part of your job is to take data on the ABCs of behaviors of interest. How to take ABC data. Taking ABC data is a direct continuous observation. The observer records, in as much detail as possible, what happened right before the behavior in question, and what happened afterwards, the consequence. This is an example of a data sheet that you may see to record ABC data. Important considerations is that you record the antecedents in as much detail as possible, the behavior in an objective way, so something we can see, remember, or observe, something we can see, taste, touch, smell, or hear, and the consequence, what the person got from it. Now keep in mind that while almost every binder will have these ABC data charts, if you find yourself without an ABC data chart, just make one from scratch. And let your specialist or analyst know that you need ABC data charts. The point being, though, that I'm trying to make here is that there's no magic in the actual data chart. It's just recognizing what the ABC of each behavior is. Now remember what kind of behavior that we are focused on. We are focused on overt behavior. Why? Because it is observable and it is measurable. So how to talk about the ABCs? We will use observable and measurable terms. What we see, hear, taste, smell, and can touch. We will use quantifiable terms, numbers that make sense and are relevant. We will be objective. We include only facts, not opinion. Who, what, when, where, and how are all questions that we'll be asking. We're not going to ask why yet. Remember, when we talk about the ABCs, we want to be observable and measurable. We want to be objective. When we talk about things, we want to be able to see them or hear them, or be able to taste or smell them, or touch them. When we talk about quantifiable terms, we're talking about giving some sort of measure, some sort of number. So instead of saying the patient hit me, we can say the patient hit me 5 times, or the patient hit his head 3 times. Because if we just say the patient hit me, we don't know how many times that actually happened. So when we talk about quantifying something, we're talking about putting a number to it. And when we talk about being objective, only including facts, not opinions, this means that we're going to say what actually happened rather than what you might think happened. For example, we wouldn't say patient was having a bad day or patient was stressed out. We would include only the facts because we don't know if a patient is stressed out or having a bad day, but we do know if they hit someone 3 times or if they were out of their seat 10 times. or if they were yelling for 30 minutes. Again, we want to be as objective as possible. When we talk about observable terms, observable means that using terms that any other person would also have seen if they were there. It doesn't include observations about what the person might be thinking, feeling, wanting, or dreaming about. Basically, only describing what you see, hear, feel, taste, or smell. Again, if someone was in, let's say, Alaska, and you sent them a video, and you gave the terms that were observable, the objective terms, they would be able to watch that video and measure exactly what you were seeing. So if you can write an observation with objective terms that anyone else can see, you're well on your way to being able to write ABC data. A question I always ask myself is, can you use any of the senses that you have to observe the covert behavior of others? Can you look at someone and know what they're thinking, know what they're feeling, know what they're daydreaming about? Okay, the answer is typically no. Sometimes you can see behaviors that correlate to that. For example, if someone is anxious, you might see them pacing back and forth, but that doesn't necessarily mean that everyone who paces back and forth is anxious. So again, we want to use objective terms that actually show what's going on or describe what's going on. Measurable terms. To make a description of a behavior of the environment measurable, include terms that talk about frequency or rate, how many times something occurred per session, duration, how long something occurred for, intensity or magnitude, how strong or how intense was the behavior. Okay. This means that a behavior analyst could quantify, put numbers to the behavior in a way that makes sense, and they could use this measure looking at the increases or decreases in those numbers over time. Basically, we want to see what we're doing is working. So we need some good data first. That data will include the frequency or rate, duration, or intensity and magnitude. There's also something known as latency, which we'll talk about later. So here are some observable and measurable examples. The child fell to the floor and then cried very loudly for 5 minutes and 23 seconds. This has both intensity and duration. Okay, the child fell to the floor and then cried very loudly, which is a measure of magnitude, for 5 minutes and 23 seconds, a measure of duration. You could also take a measure of frequency, right? Because the child fell to the floor. Frequency one time. The boy jumped directly up 2 feet into the air and yelled out, "Hooray!" very loudly. Okay, we have a measure of frequency. The boy jumped up, okay, one time. And you have a measure of magnitude, which it says yelled out, "Hooray!" very loudly. The woman drove at an average of 65 miles per hour. This is a measure that shows a magnitude of how fast she was going, which is 65 miles per hour. This one, he lightly hit his brother with an open hand on the arm twice during session, includes a frequency and a magnitude. He lightly hit his brother is a magnitude. With an open hand, that's a very good objective way to put that, on the arm twice, which is frequency during session. Those are all observable and measurable examples. Anytime we are describing what happened during session or writing ABC data, you must use objective language. We're going to talk about the facts: who, what, when, and where. We don't ask why, because why is a matter of opinion, not a fact. If my patient hit his head 3 times, and I said he hit his head 3 times because he was angry, that would be my opinion, because I don't know if he was really angry or not. Instead, I would just stick to the facts that he hit his head 3 times. When writing my notes or writing ABC data, and I'm describing the who portion, I will ask myself several questions. Who does the behavior happen with? Does it happen with everyone? Who was present in the environment when the behavior was occurring? And who was doing what? Those are all questions I would ask or describe when describing the who portion. When describing the what of behaviors, I would ask, what was the instruction? What was the demand given? What is happening in the environment? Or was there some sensory stuff going on? What could the person see? What could the person hear? What could the person smell? What could the person feel? Those are all questions we can address by objectively describing the what portion. When describing when a behavior occurs, we might ask ourselves, does it happen at a particular time of day? Does it happen on certain days? Does it happen after a certain activity? Or transitioning from something, say lunchtime? When we're talking about where a behavior happens, were we in the living room? Were we in the kitchen, bedroom, etc.? Were you sitting on the floor or at the table? Did he put the cup on the counter or in the fridge? Did he put his toys on the couch or back in the toy box? Where is a very important thing to describe when we're talking about creating objective notes or doing ABC data. Again, we're not going to worry about why yet. Example of why descriptions was he wanted the toy, he was hungry, he was tired, he cried because he was mad at me. Those are all opinions. Those are all things we don't have to worry about yet. Okay, we don't know why a behavior occurs yet. So when we're describing or generating objective session notes or doing ABC data, we're not going to worry about the why yet. Here are some examples of non-objective observations. He hit me because he didn't want to work. Why is that not objective? Because we don't know if he wanted to work or not. She was screaming because she missed her mom. Again, that's trying to address the why question. We don't know if she was really missing her mom. He didn't want to work today because he was tired. Again, we don't know if he was really tired or not. All three of those statements could very well be true, but they are not objective. Remember, we are professionals and we are acting as clinicians. The notes that you will be making are medical records, and we want to be as objective as possible. Here are some examples of objective observations. He hit me after I told him time to work. That is an objective description. He hit me after I told him it's time to work. There is no feeling in there as far as what the person was feeling. It just describes what actually happened. Second example, she started screaming after her mom left the room. Again, maybe she does miss her mom, but that is not really relevant for the objective part of these notes. All that we know is that she started screaming after her mom left the room. He didn't get his regular nap today. And he eloped 2 times from the work area when given demands. So here we have frequency, 2 times. We have what actually happened. The word eloped just simply means here escaped. And we have a description of what might be known as a setting event. He didn't get his regular nap today. Again, it is free of what the person may be feeling. We're not saying he's tired. We just are saying that he did not get his regular nap. That is an important observation, and when we talk about setting events later, we'll get to why that is important. But just know that all 3 of those are good examples of objective observations. So, in taking ABC data, the who, what, when, where, and how questions are important to consider when writing the observations. They help build a more complete picture for the analyst and the specialist. So, when to take ABC data? Whenever something unusual or important happens. Here are some examples. When a behavior is more severe or intense than usual. When the person engages in aggressive or destructive behavior. When self-injurious behavior occurs. Or the specialist or analyst has asked the team to take ABC data on the behavior. As you get to know your patient, you will get to know what behaviors are more common. It is always a good idea to take frequency data or duration data on each behavior. You don't have to take ABC data all the time, especially if there's already a lot of ABC data taken on that behavior. And again, it's very difficult to tell you when that might be happening or when it would be appropriate or not appropriate without actually seeing the person. The best idea, though, is if you don't know what a behavior is or why a behavior is occurring yet, if you don't have a lot of ABC data on it, it's probably good to take ABC data. Or if it's a new case where a lot of data has not been collected yet. Again, it's really important to take ABC data when we're trying to find out what the most common consequence is of that behavior. So if you're working with a patient and a behavior occurs that you've never seen before, and it seems to be occurring a few times that day, that would be a great idea to take ABC data. But if you've been working with a patient for 3 or 4 months, and a behavior that the patient normally engages in, and you already have a lot of ABC data for, it may just be good to take data on frequency or duration, that not necessarily having to write a full ABC up for that behavior. Again, it will depend on the specialist and the analyst asking you what to do. As an RBT, it is your responsibility to know what behaviors you are taking ABC data on. So when you guys have team meetings and all that kind of stuff, make sure that you know what behaviors you're taking ABC data on. So let's talk about these observable, measurable, and objective terms a little bit more. We are always describing our patient's behavior and environment in observable, measurable, and objective terms. This is something that's expected in the whole field of applied behavior analysis. We use these terms for our team comments and notes as well. Basically, whenever we're describing or working with our patients in this professional manner, we're going to use these kind of terms. So in review, the antecedents, the A's, come immediately before the behavior. C's, the consequence, come immediately after the behavior. The only behaviors that we focus on are the overt behaviors. Remember, the things that we can see. When describing the ABCs, you must use terms that are objective, what we can see, hear, smell, touch, basically overt behaviors, right? Measurable, that means they're quantifiable, we can put numbers to them. And objective, the who, what, when, and where. These are all things that we're going to use in ABC data as well as taking objective notes at the end of the session, or when we're describing the behaviors to our specialist or analyst during team meetings. On the RBT task list, there's a term in A02 that says continuous measurement procedure. So what is that? Continuous measurement means that we're going to take data on each behavior. We're continuously observing it. Okay. Again, continuous measurement procedures say that we're going to take data on each behavior as it occurs continuously throughout the session or observation period. This is in contrast to a discontinuous measurement procedure, where we're only going to take ones on a certain time frame or in a certain interval. We will talk more about discontinuous measurement procedures later. For right now, we are going to stick with continuous measurement procedures. Okay. Again, continuous being we're going to take data on each behavior as it occurs continually throughout the session. Frequency data is one type of continuous measurement procedure. It is called continuous because you are continuously observing the behavior for a given amount of time. In this case, for the RBT, it is your shift with your patient. Here's an example of what a frequency data chart might look like. Frequency data charts allow us to take a frequency measure and the number of times the behavior has occurred throughout the session. Frequency. How many times does the behavior occur during the session? This is taken on your frequency data sheet in the back of the binder or wherever it is in the binder for that particular patient. Duration, how long the behavior was from start to finish. This is a less common measure, and you'll typically need a timer. That's not much of a problem anymore. Most cell phones, smartphones have a timer on it.